So in today's video, we're going to go over different loading protocols for the Achilles tendon. And in the previous video, which we're going to post up in the corner up here, we went through some of the diagnostic algorithms that we go through with each of our patients to kind of find a good starting point where we need to start with these exercises to load up the Achilles tendon. So today we're going to go through just a few progressions. So we're going to have our patient come stand over here on this flat surface. So one of the things that we start off with usually is having a double leg heel raise. So what I'm going to have the patient do is stabilize himself on the bar and go ahead and push up onto your toes. And go ahead and repeat a few repetitions of this. And so we've already done the exam, but we're still watching the technique, looking to see if there's any churning of the heels that would be avoiding some of the symptoms, because we do want him to try to load the tendon properly and equally on both sides. And he's doing a good job with this. Now, if a patient is trying to churn the foot or rotate away from the pain, there's a couple strategies that we can utilize to encourage the proper loading. So if he was pushing up and rotating the foot outward and taking pressure off the inside part of the foot, we're going to utilize a band to where we can stick it underneath the big toe and instruct the patient to keep pressure down into that point of the foot as he's going through the calf raise. So you can anchor the band against a doorknob or door or hold on to it while you're going up and down into the motion. And by pressing down on the band, we're getting proper loading through the entire Achilles. Now, if they start compensating or skirting around the motion, then the band will snap out and they know they need to reset with proper emphasis into that medial portion or inside portion of the arch. So this is a good starting point for many patients, but as they improve and get strength into the muscles and the ankle, then we start progressing into an elevated surface to start getting more range of motion. So I'm going to have him step up onto a step. So at home, patients will do this off of a curb or off a step in their house, and they can go into a double leg calf raise again. So go ahead and push up and then lower all the way down and just go as far as you can with your own flexibility, your own range of motion, and then you're going to prop back up. Now, when you're doing these initially, you want to do it nice and slow, a few seconds on the lowering down portion, and then come up a little more quickly to get to the starting point. As this exercise becomes easier, patients are able to do 3 sets of 10, 3 sets of 15, 3 sets of 20 relatively easily. We're going to progress to a single leg stance. So this time we're going to shift over to the symptomatic side and have the patient lower down as far as they can go, and then use both feet to push back up, and then shift weight over onto the symptomatic side again, focusing on the lowering, nice slow contraction all the way down, and then coming back up. Now, as they progress through this, getting it into 3 sets of 10, all the way up to 3 sets of 20, that then we want to load the tendon even further to work on the resiliency of the area. And then we'll have the patient hold on to dumbbells, we'll have them hold on to kettlebells, whatever we can do to get a little extra load to further bolster up the tendon. Okay, so the exercises that we've been talking about so far have been in more of a straight leg variation, but the Achilles is made up of 2 primary muscles. We have the outer muscle, the gastrocnemius, and we have the deeper muscle, the soleus. So to target the soleus more effectively, we want to do some exercises in a bent knee formation. And the soleus stops in the lower leg about here. So to target it more specifically, we're going to have the patient bend the knees a little bit more so it feels a little bit of stretch into the soleus. And then from here, we're going to do the same type of exercise we were doing before, to where we're going to have the patient press up through the toes, keeping the knee bent in that formation, and then lowering the heels off of the platform to try to get as much of a stretch into that range of motion as possible. And then same type of progression that on the symptomatic side, we're going to get them to do 3 rounds of 10 to 20 repetitions on a single leg stance. So shifting, keeping the knee bent, and lowering off the ledge as far as possible, doing a nice 2 to 3 second slow contraction on the way down. Now, a couple other variations of this exercise, we can have a patient do a wall sit or a wall squat while in the similar position, having the bent knees, holding the squat position, and going up onto the toes and lowering all the way back down to the floor, and repeating that to target the soleus more specifically. Now, a more strenuous exercise that starts incorporating a little bit more stabilization and activation of the posterior chain muscles is going to be this variation of soleus activation. So go ahead and lay on your back and putting the feet up onto the foam roller. So here we're going to first incorporate some core activation, gluteal activation by doing a bit of a bridge. So go ahead and press your body up. And then from this position with the knees bent, we're going to be going into the calf raises again. So go ahead and press up as high as you can go and then lower it down and keep going in and out of that range of motion. Now this is a very challenging exercise, something that we will progress patients to as they're getting ready to get back into their activity. Now this one is already challenging enough in my opinion, but to get a little bit more specific for getting back to sport, we want to do more single leg variations of this. So go ahead and press up into that same position, and then we're going to have him march on the foam roller, keeping the toes pressed down, the forefoot pressed down into the foam roller, going in and out of this position. So this is working on the timing of the contractions, keeping a nice powerful contraction each time the foot's touching the ground. Good. Go ahead and take a break there. So one of the final variations for loading the soleus and the Achilles tendon, we're going to have the patient put the symptomatic side up onto a platform, and they're going to get into a lunge type position. So then from here, they're going to hold this isometric position through the lunge, and then they're going to point their foot up and down through a full range of motion while creating stability into the lower extremity and the core. Now, as this becomes easier and easier, we're going to make it more challenging for them. So we're going to hand over the dumbbells, get more load into the lower leg and the tendon while performing the exercise. Good. So then the final progression of exercises that we'll get into with patients is we want to work on a little bit more of the dynamic strength, a little bit more of the explosive power in the tendon. So first we get a good baseline and strength going through the muscles and the tendons, and then we'll progress into more dynamic, more plyometric type of exercise. So first starting point might be just getting the patient used to contracting and using those muscles under motion. So we'll have the patient just stand up and walk forward, walk backwards while maintaining strong contractions through the feet and the lower legs. As that gets easier and easier, we can hand them dumbbells, we can get more weight behind it, we can make it asymmetric depending on what the goals are and what we're trying to load. Easy way to load the tendons in an explosive manner is to do some jumping techniques. So you can just do stationary hops. So go ahead and hop up and down, kind of like your jump roping. Jump roping is also an exercise that you can do to develop the explosiveness in the tendon. The pogo hop or pogo jump is another way that you can activate the tendons in a more explosive type manner. And then doing bounds to where you're going to be exploding off of one leg at a time forward to work on very strong contractions, exploding through the lower leg and the tendon. And you can do it in a variety of ways. Then, depending on the person, depending on the sport that they're doing, there's other exercises that we may target more specifically for them. Just depends, again, case by case, what we need to work on for that patient to have a successful return to their activity. So with all of these exercises, a common question that we get from patients is, should I be doing these if I have pain? And when you are recovering or working through an Achilles type injury, the answer is yes. We want to load the tendon, load the muscles appropriately, and some discomfort, some pain is actually okay. And we go by a green light, yellow light, red light process, meaning that green means there's very minimal pain while you're performing these exercises. Go ahead, go through the full sets, reps, no problem. Yellow light means that there's some pain, but it's okay to keep working through it. But we want to avoid any significant change in the intensity of the pain or worsening pain as you're doing the exercises. So we usually put a cutoff of around 5 out of 10 on the pain scale. So if pain starts increasing above that, that gets into the red light zone, and that is when you need to stop performing the exercise until we can reassess and regress the exercises or find the exercises that are going to benefit the patient at where they're at in the recovery process.